to get into the specialties, the things you can do to get into specialty, what the actual training program is like, and what life as a consultant is like. I think it's quite useful to get that experience or that knowledge of what that's like as well. So essentially, what is SEM or sports and exercise medicine? So essentially, it's what you know as a Group 2 specialty. What that means is, so medical specialties are divided into those that are kind of dual accredited with general medicine, so acute medicine, or those that aren't. So sports and exercise medicine isn't linked to that, so you don't do any acute medical on calls. You just do your medical rotations linked to sports and exercise medicine. And it's entered at the ST3 level. So I put this picture up, useful to understand a little bit more about how you get into it. So it's entered at what you call the ST3 level. What that means is, so ST stands for specialist training. And once you've completed your medical studies, you do your 2 years of foundation training, and you have 3 pathways into which you can get into it. The one that I chose was what is now known as internal medicine. It was previously known as core medical training, and it is now 3 years. But when I did it, it was only 2 years. You can do the first 2 years of that training program and enter sports and exercise medicine. You can do 3 years of general practice, which is what the majority of people do. I think if you put a percentage on it, out of the number of trainees across the country, say probably at least over half, maybe 2/3 of GPs by background. Or you can do something called acute care common STEM. So that is another training program which has actually 3 branches itself. So not complicated too much further, but so that's either emergency medicine, acute medicine, or anesthetics and ICU. So if you do the emergency medicine branch of that, after 3 years of that, you can enter sports and exercise medicine training. And even prior to SEM training, you have to do the exams for those specialties. So I did my MRCP about 5-6 years ago now. And then you enter the 4 years of sports and exercise medicine, which I will go to the next slide, just to explain what it is, because not a lot of people know about it or what actually training involves. So let's just go through that in a bit. So a lot of people just ask me this, which is why it's the title of the slide: don't you just work for a sports team? Actually, it's much more than that. And to be honest, for me, working in a sports team is less of what I do. It's probably the smaller portion of my weekly work. So as a registrar, so as a trainee in sports and exercise medicine, you'll end up working across many specialties. So namely orthopedics, closely with orthopedics, rheumatology, you do a bit of general practice training as well. I'll explain why. Do a lot of stuff very closely with the military in terms of defense rehabilitation medicine. You do the kind of minor side of A&E, so wound injury management, acute fracture management, and soft tissue injury management as well. Public health is really important. I'll explain why as well, but you might think, what's that got to do with sports and exercise medicine? But actually, exercise in the prevention of chronic disease is something that's a huge focus of our specialty, and a lot of people get involved with various projects to do with public health aspects of sports and exercise medicine. And radiology, so more and more frequently, sports and exercise medicine consultants are using ultrasound in clinics to diagnose and treat patients, whether it be steroid injections, a different type of injections under ultrasound guidance, except of being an SEM clinician, and certainly something I've had a lot of opportunity to get involved with as a trainee in East of England. But also you do work in specific NHS musculoskeletal clinics, which are run by SEM consultants, more and more so now. So the specialty was only set up in 2005 off the back of the Olympic bid. So even though the Olympics were in 2012, the actual bid was back in 2005, and the first set of registrar trainees came through in 2007, or started in 2007. So it's been going for about 16 years now. And on average, you get about 10 trainees per year across the country. It doesn't sound like an awful lot, and it isn't compared to lots of other specialties, but numbers are dotted around the country. So normally you have a couple of trainees in London, a couple in the East of England, a couple in the Midlands, a couple in the Northwest, near Liverpool and Manchester. And, so it's quite widespread where trainees are based, and therefore you do get varying opportunities to work with different departments, but also different sporting teams I'll come across in a bit as well. So when I started training, I knew a bit more aware of, what training would involve, because I spent a lot of time going around the country doing different clinics. I sat in clinics in London, in Oxford, in the East of England as well. And it became quite apparent that really, even if you work alongside the SEM consultants, you're never going to be spending 4 years just doing sports and exercise medicine, you will spend time in orthopedic clinics, rheumatology clinics. The reason you do 6 months of general practice is because if you work for a sports team, you essentially are their GP. So, when you're on the road, you're traveling with a team, when you're doing stuff with a team, they're going to ask you various questions that aren't just to do with musculoskeletal injuries, and you have to know how to manage those things. So I'm not saying what I do the day-to-day job, but I work in the military as well. So the rehab side of things is really important because I work closely alongside the military physios to rehab patients who are injured in kind of training for active service. Yes, there's an active war going on right now in terms of, well, huge wars in terms of what the UK getting involved with, but there's certainly a lot of injuries and I see in the military, and I explain why that's important because it's a massive part of our specialty as well. So yeah, there's a lot of things you can get involved with, a lot of things you can do, and that's why it's not just working for a sports team. I put that at the very bottom. Absolutely, for some people as a consultant, that is all they will do because that's all they've wanted to do. Some people will purely just do MSK clinics. Some people will purely, do it just, as I say, match day cover and sporting events. And some people, and most people, will do a mix of both, if not many other things as well. So I put this slide up because this is various things that I've got involved with before, and the little bit at the bottom. So the fourth thing at the bottom: military defence, Essex Cricket, SNF to East Suffolk North Essex NHS Foundation Trust, and out of the blocks is what I'm currently doing. I'll explain that. So things that you can get involved with. So when I was a medical student and as a junior doctor, like F1, F2 level, I got involved with a company called Sports Medics, which are still running. I was part of the medical team for Tough Mudder events. They no longer cover Tough Mudder, but they do lots of kind of running events, marathons, swim events, triathlons, lots of different things I get involved with. So that's a huge opportunity to spend some time seeing how sport and exercise medicine doctors work kind of in a sporting environment, in a kind of a mass participation event environment as well. So again, when I was in my F1, F2 year, I did some stuff with Charlton Athletics. I was one of their academy doctors. I've also done some stuff with Bucks, British University Championship, call it British University Sports. So that was, I think I've done various events with them, for example, boxing. And it's a good opportunity when you kind of looking at opportunities before you get into training for things to do. More recently, during training, I've also had the opportunity, even though I'm not based near where Fulham is, I was working for them previously before I entered my registrar training. So I did a bit of work for their academy. And during training pre-COVID, on the top right, I did work for Cambridge University Rugby. That's a great opportunity because you see lots of injuries, and match day cover is also quite interesting because it's never quiet. And likewise, I've covered the St Joe's College National Schools Rugby Festival, which is an annual event, or at least it was pre-COVID, of all the best rugby schools in the country for a two-day event, two-day competition, which again had lots and lots of injuries to manage. And it was a very interesting thing to go involved with. And even as a student, you can come along and see it if you wanted to. I don't know how many of you guys have heard of Moving Medicine. So that is an initiative set up by the Faculty of Sport and Exercise Medicine. So they are essentially the governing body of sport and exercise medicine, who are involved with setting the exams, but also lots of health initiatives. And they, alongside Sport England, devised essentially various modules of how exercise can be used to manage chronic diseases. And essentially, if you go on the Moving Medicine website, you will see a different page, a different kind of set of resources for lots of different conditions. I got involved with the one for diabetes, and it's a fantastic thing to get involved with as a medical student, and again as a junior doctor as well. So that's quite a lot of research goes into those modules, and essentially it's helping anyone have conversations with patients about being more physically active to try and reduce their risk of certain diseases, but also for those patients with those diseases to try and improve their overall health. And we've also had the chance to work at London Marathon as well. So that was mainly as a volunteer, but it's still a quite interesting experience. And again, certainly something you guys can get involved with as well, if it's something you want to do. So what do I do on a day-to-day basis now? So having gone through training, as I said, I train through the East of England, which is pretty much through Ipswich and Cambridge. Those are the two main locations where I did most of my training. Also, I did some in Colchester. I actually live in Chelmsford, so I kind of split my time between all locations really. So I do 2 days a week at the Ministry of Defence. So that is basically a regional rehab unit in Colchester. So the way the army is set up is that it has essentially a medical officer who's basically the same thing as a GP. Sorry, I probably can hear my daughter. She's just screaming in the background. Apologies for that. Give me 1 second. Yeah, so I do 2 days a week with the Military Defence. As I said, the medical setup for the military is that you've got essentially like a GP who they'll go to. And then if they get referred up through their GP in the rehab chain, we see them at the regional rehab unit. So they can be seen there. And then if we can't manage them, they get essentially seen by a tertiary centre. We see lots of interesting injuries there, lots of joint injuries. You know, the army get put through their paces as you'd expect they would. So you'll see lots of interesting injuries. And during those clinics, I get to scan patients on ultrasound and also inject them as and when, if required. So that's a really interesting clinic. I do that 2 days a week. I spend 1 day a week working at Ipswich Hospital doing a musculoskeletal ultrasound list. So that is a pretty busy list, 9 to 5, a little bit of a break in the middle of the day. But again, it's quite nice to be there. I did part of my training with one of the consultants there. So a job opened up when I finished my training about a year and a bit ago. So that's pretty interesting. And I still do that. And I also do work for Essex Cricket. That's a bit more ad hoc. So the main 3 days of my week are split between the MOD and the NHS, which is a Wednesday, Thursday, Friday. And I work with Essex Cricket for the rest of the time, depending on what's going on. Something else I've got involved with is the Faculty of Sport and Exercise Medicine is something called Out of the Blocks, which is a supportive group for new SEM consultants. Even though I've only been a consultant for a year, I took that, as a role because it's quite interesting to help other consultants along their way. So we organise talks at various events, and yeah, we just organise catch up and get together as well, just to support new consultants because it can be quite tricky to navigate your first years and first few years as a consultant. Please stop me if there are any questions. I appreciate there might be some already, but let me know if there are any. Okay. So other things to bear in mind, I've just got some resources here that are quite useful. I'm happy if you guys have this presentation. It's not much more to it, but there's a couple of links that can be quite useful. So the first one is essentially a description of SEM on the NHS website from a health careers perspective. And it just goes through kind of what the specialty is. But in more detail, you'll find something on the JRCPTB website, which is the Joint Royal College of Physicians Training Board. So all medical specialties will have essentially a dedicated area of that website. And there's a lot more information about what SEM is, training numbers across the country, where you can do SEM training, and essentially a little bit more about what it involves. Got 2 websites there, the faculty, which is FSEN, the Faculty of Sport and Exercise Medicine, which again has quite a lot of useful information about kind of what the faculty is, what they do, and a bit more about SEM. And then BASMS, I don't know how many of you heard about, that's the British Association of Sport and Exercise Medicine. So they run the annual conference and lots of other training opportunities. The annual conference actually is in Manchester next week, which I'm going to. So it's a nice opportunity to not just network with colleagues, but also spend a couple of days listening to lots of interesting talks as well. So they organise that and a lot of the other educational opportunities. And they're also kind of involved with the British Journal of Sports Medicine, so the kind of SEM national journal, really. And then there's a website at the bottom, which is Sports Medics Limited, the one I mentioned before, about getting into opportunities to work at various events. So if you guys are interested in that, then definitely have a look at that. And if anyone is interested and wants to get to know people who are involved with that, I'm more than happy to give out contact details of those who are involved in various events. That is pretty much my presentation. I didn't have much more to it, to be absolutely honest. But I'm keen to kind of hear your guys' thoughts or get any questions you guys may have.
Cheers a lot, Sethu. Thank you. I had a couple questions in my DMs that I'll just read out here. So,
Sure.
At one of these events that you posted, is it possible to get paid as a doctor at one of them as an F1 even? Like, do you have to do a short course or qualification? Or do you have
So essentially, I should mention that before, but to work essentially pitchside, you need to have a pitchside qualification. So that can be done through the FA, through the RFU, so the Rugby Football Union. Those are the 2 most common ones. So the FA's one is called APMIF, which is, again, it's just a pitchside course. It is more geared towards football, but since a couple of years ago, they decided, regardless of whichever one you do, it'll cross cover all sports, so it doesn't matter too much. The rugby one is a bit easy to get onto. So the one that I've done is more trauma based, but I guess I've done more rugby stuff than football stuff. So those are the two main ones. There are a couple of smaller ones, but generally most people will do one of those two. So yeah, you'll need to do that. It depends what you're doing. So if you're the main doctor, then absolutely you'll need that cover. If you're just shadowing or you're just observing, you won't necessarily need to do that. But obviously, in terms of being picked side and getting paid for those, so most of them, if I go back, so in terms of paid roles I've done, so yeah, the sports medics, Tough Mudder was paid, Charlton Athletic was paid, Box was paid. The only thing that wasn't actually was the London Marathon. It never tends to be, which is, I think that's the way they always set it up, to be honest. But everything else pretty much is a paid role. And I think when you're working as a doctor, I think it's hard to do more volunteer stuff. You're used to getting paid, and I think it's important. I think, yeah, so I think it's always worth looking into those things before you do them. But certainly there are certain opportunities that are definitely worth taking. And the thing is, as long as you're keen and you show interest, there's a lot of opportunities out there. Like, for example, when I was doing the stuff with Charlton, yeah, it's working for an academy, it's going to games on the weekend, like a Saturday morning. But you just build up a relationship with the coach, the physios, the other doctors there, and actually that just gives you more and more opportunities, basically. Because I think you guys realize if you enter the world of SEM, it's not a huge world. Most people know each other, and they will be able to recommend people to each other. So yeah, it's always worth, I think, being keen. If you are designated to go to an event, turn up on time, be proactive, know what you are there for, what your role is, who else you're going to be working with. Those things are important, I think, in anything that you do, to be absolutely honest. But I think in such a small world, I think it's just good to have a good reputation.
Yeah, thank you. So I guess along those same lines, another question is from someone else is what the best thing to do now is basically as a medical student if we're interested in a career in sports med.
Okay, so I think as a medical student, so one thing, so I like to split it into two things. One is a sport, and I guess one is exercise medicine / research. So in terms of sport, there's loads of opportunities to work with the club. So I guess even being in Cambridge, even university sport is huge. So Cambridge University rowing, Cambridge University rugby, they're two of the things at the top of my head that you guys can get involved with. Depending on, the rowing, obviously the correct season, but they'll train a lot of the year. So I'm sure you guys will know that. But getting involved with that, they have a good medical team. They do, obviously, it's cardio screening, free rowing season. So all that stuff you can get involved with, the kind of stuff. I think there are loads of sporting clubs like Cambridge United Football, even further away from that. Obviously, one thing I actually missed off there was I did a season with Colchester United Football as well. So that's another opportunity. There's lots of clubs out there, and even cricket and stuff. So there's lots of sporting things you can get involved with as a medical student, because to be honest, it's easier for you guys to come along as a medical student, because I guess the paperwork is less to do for you guys just to observe and watch. I guess as a junior doctor, as an F1, F2, there's still opportunities to get involved with that stuff. It might not be that you are the main person there. Obviously, I wouldn't expect that would be the case, but you'll get the opportunity to see what the job is, what the day-to-day job is. I think that's important because from the outside, it can seem like it's a really glitzy, glamorous job. It isn't always at the end of the day. I think, there's a lot of hard work that goes into it, and actually it might seem really cool to that you'll be on TV or whatever you're covering, but actually it's the travel, it's the day before, day after. It depends, depends what you like. So the reason I don't do loads of stuff is I've got a young family. I don't want to spend too much time away from them. And actually right now I won't do loads more sport than just a bit of cricket. So everyone's different to that. Everyone's family setup is different. So there's that stuff. Moving medicine is really something interesting to get involved with. It's actually really straightforward to get involved with. There's lots of research going on with those modules. So that's something to do. It's something to get you into the public health aspect of it. And more than anything, it gets you working with other like-minded individuals, but also other SCM consultants you will bump into through that program, who then you may get into go and sit in a clinic with them, or who may give you an opportunity to, say, work in an event that they're working at. So it's a lot of networking through that as well. It's probably the best way to do it. There are obviously clinics So the shame in Addenbrooke's is there's not an SCM clinic that runs out of Addenbrooke's at the moment, but in the east of England there are ones in Colchester. Obviously, I'm doing my ultrasound clinic in Ipswich. So there's lots of other opportunities to do kind of or get first-hand experience in clinic. So definitely the clinic in Colchester. There's actually two other SCM consultants who work there. There's actually 4 of us across the east of England at the moment. There'll be a 5th one soon as well. So there's a lot of us around just doing different jobs. So I guess those are the main opportunities. But I think, and again, even with the sports medic stuff, there is so many events all over the country. If you guys are prepared to give up a weekend, and you will get paid even as an F1, F2 for that. So your role will be pre-specified. So the person who runs it is someone called Natasha Beach. She's an SCM consultant, and she does a lot of the organising for that event or those events. So depending on your level of expertise, you'll be kind of put into a particular role. So that's that essentially. But yeah, there's lots of stuff out there. It's just asking, and just basically there's no harm in asking. What's the worst someone can say is no, they're too busy. So
Yeah, cool. Thank you. Thank you. Another question we had was, does the pathway you choose to go into sports med affect what you can do once you start specializing? And does that affect how likely you are to actually get onto the training?
no, no, I don't think it does. So I think obviously there's 2 questions there. I don't think I said I did core medical training, which was basically few and far between when I joined the training program, mostly with GPs with background. It doesn't affect your opportunities when you're on the training program either. So I think it's you're pretty much at a level playing field. Yeah, absolutely. Like if you're a GP by background, you don't obviously have to do as much general practice during your training program. You still have to do a bit of it, but you might have a bit of an upper hand in that kind of stuff, or how to manage some of the issues that crop up in team medicine or team sports medicine. But overall, to be absolutely honest, I don't think I've lost out with having not done general practice. I think the reason a lot of people do it is because it's a bit of not a fallback, but ultimately they can still practice as a GP as long as they keep up their numbers in terms of patients they're seeing and clinics they're doing. So essentially, you are doing 2 specialties as you qualify as an STM consultant, but some people still want to do their bit of general practice. And I think that's the main reason people will do it. But there are plenty of people who I know who've come through acute medicine or core medical training, as it was, and been absolutely fine. So yeah, it doesn't really affect your opportunities. And ultimately, there's no benefit of doing one over the other in terms of getting into the specialty, in terms of like your points that you get on an application, because they've tried to kind of level that out now.
Yeah, cool. And related to that, I guess, how competitive is sports and exercise medicine, and like, would there be more roles over the next few years, or?
Yeah, I think that's a good question. I think in terms of when I started, so there were about 14 numbers across the country. I think about 30 to 40 people applied for it before it got to interview status. Everyone applies and they check who's eligible from the application process. During COVID, those numbers went down in terms of the number of jobs available, just because of, I think, I don't know why quite, but there were various issues with like funding for training places and things, and I think that affected it a little bit. I think in terms of job opportunities, there's always a drive to get more NHS consultant posts, and that is always a bit of a headache with such a small specialty. But it's up to the consultants like myself and others to drive that initiative through in the hospitals that you work in to try and create those posts, because ultimately, with such a small specialty, you have to make yourself known. There's no other 2 ways about it. And it is about having allies in hospitals, for example, with orthopedics and rheumatology, teams you work really closely with, because ultimately, they have a huge say in how musculoskeletal services are run in a hospital. But certainly, a lot of MSK clinics aren't just run out of a hospital. Some of them are run out of like various primary care centres or kind of somewhere in between primary and secondary care. So it's not always in a hospital. But absolutely, there are definitely more and more opportunities, even compared to when I started. So the ultrasound list that I'm doing in Ipswich Hospital didn't exist for an SCM consultant when I started training. It was just that luckily on a Friday afternoon, I was always available to go and do a list with that consultant, and you build up a relationship with them. I've known them for about 5 years now. And then when I finished training, naturally following COVID, there was a backlog of patients that needed to be seen and scanned, and they didn't have the capacity to do that. And I was there. So it's just sometimes it is being right time, right place. But even when that happens, it's then about keeping those doors open, making sure that people know who you are. because that's always the hardest thing. So a lot of things. One thing I haven't really mentioned is private practice. So SEM consultants do that. I'm going to start a private clinic in about a month's time or so, and I have a bit more time available to do that. And I guess, part of me always wants to give back to the specialty. It's an NHS training program. So working for the MOD is actually under NHS pay scales and various things like that. So essentially, it's a public sector job. It's not private at all. So all my work apart from the Essex cricket stuff is all public sector work. So, but I think there comes a time when people do want to start branching into private medicine for various reasons. It's not always about pay, but it's something about conditions that you see patients with or the working conditions. I think that's also another side of things to think about. I think people do lots of private clinics all over the place, and that's another thing people can get involved with. But from an NHS perspective, I think it's really important to be aware there are definitely clinics out there. It's also important that when these clinics come up, people take the jobs. As I say, because they are like dotted all over the country, there's not always someone living right there to take the job. So it's about, can you relocate your family? Can you relocate your life? All those kind of things are not easy things to think about, but there are definitely jobs that come up here and there. And I think that's why a lot of us also work in the military, because a lot of SEM consultants do those jobs because they are quite readily available as well. It's just that they're in various locations and they're not kind of in main cities or kind of areas which are hugely populated. So again, it's just another thing to think about.
Cool. Yeah, makes sense. Thanks. And last question, I think. What made you choose sports and exercise medicine, and any regrets?
That's a good question. So I really wanted to do core medical training. I love to keep medicine. I really enjoyed that. That's why I went into that in the first place. And actually, I did a BSc in sports and exercise medicine at Barts in 2011, 2012, so just around the time of the Olympics. That was my first kind of introduction to the specialty. And I got to know people through it. And through then going to various conferences, various courses, meeting people, I kind of thought, yeah, it's worth doing, even though it's relatively competitive and quite niche. That's kind of what got me interested in it. I quite like the variety, to be absolutely honest. So even during training, especially in East of England, you're not just doing one thing the whole week. So, various years you'll be doing bits of orthopedics, bits of rheumatology, bits of SCM clinics. And I really enjoyed that. And that's what I really enjoy right now, having that flexibility to not do the same thing 5 days a week. And some people want that, so it's absolutely fine. I think for myself, I think I had the opportunity to work, Wednesday, Thursday, Friday. I did a bit of work from home on a Monday, but then Tuesday I get to look after my daughter and do other stuff. And I think it's quite a nice balance. And I don't think you get that in lots of other specialties. And I think, maybe I guess the negative of that is job security. I mean, I'm quite secure in my NHS and Ministry of Defence jobs. There's a kind of long-term contract, and I think, it's quite good. But if you work for a sports club, then it's quite a tenuous situation, because if the club changes management, then you're liable to be not sacked, but essentially have to leave. So it's not always that straightforward. It looks glitzy and glamorous, as I said, but there's lots of politics underneath that as well to think about. But doesn't mean you shouldn't go into it. Doesn't mean you shouldn't take those opportunities. It's just having that thought in mind as well. But I don't think there's too many negatives. I think for me, I've enjoyed the fact that I can have quite a flexible approach to work and have a good work-life balance doing that, which I think for me is really, really important, to be able to enjoy the job I'm doing, but also enjoy things away from the job as well. So I think overall quite happy. I think, the one thing for me that I would like to push more and more is the NHS side of things in terms of NHS job opportunities. I think it's always a bugbear of all SCM consultants, because it's something we want to drive forward in order to keep the specialty thriving. It's really important. So we've got to think as many ways as we can to do that. But I think for me, that's always a bit of a headache, I think, to try and figure out how we do that best.
Yeah, thank you very much. Yeah. And I think that's all the questions. And I think I'll stop recording there. So